In this video, we are going to revise impact of COVID-19 on internal migrant in India. Hello everyone, welcome to the Tapasya for IS YouTube channel. So let's begin. Internal migrant, nearly 600 millions 2022 census 2011, including 200 millions interstate migrant. COVID-19 impact. Exposed vulnerabilities in economic, social and healthcare domains. Key impacts: economic shock, job losses nearly 10.8 millions in construction, manufacturing, services. Wage decline, exploitation, reduced remittance, hunger and destitution due to lack of income. Reverse migration, mass exodus to home state due to job fears. Arduous journeys on foot cycles led to exhaustion, accidents. Family separations, increased risk of domestic violence, trafficking, child labor. Healthcare challenges, crowded living conditions increase COVID-19 risk, limited access to healthcare, testing and awareness, stigma and mental health issue unaddressed, policy gaps, weak data on migrant demographics, lack of coordination between central state government. ISMW Act 1979 excludes independent migrants, limited social security for informal workers. Government measures, economic support, PMGKY, free food grants, cash transfer, आत्मनिर्भर भारत रोजगार योजना, job creation incentives. Transportation, श्रमिक trains, 4,600 trains, 63 million migrant transported. Healthcare, dedicated COVID-19 testing, quarantine centers. Regional language awareness campaign. Policy reform, e-Shram portal, 28 crores worker register. 2024. O1 ORC, 80 crores beneficiaries for PDS access. PM Sonadi, microcredit for street vendors. Draft National Migrant Labour Policy 2021, Niti Aayog. Approaches, cash transfers, courts reservations, enhanced community agency, skill development, legal protections. Recommendations, amend ISMW Act 1979 to include independent migrants. Ministry of Labour as a nodal agency. Migration Resource Center, National Helpline. Interstate migration management bodies. Panchayats to maintain a database, issue ID cards, skill training, education for migrant children, urban housing, grievances cell for waste violation, trafficking. Age and sex structure, as structure. Dependency ratio 65% 2011 to 54% 2036 projected. Young 0 to 14 373.9 millions 2011 to 306.4 millions 2036. Elderly 60 plus 101 millions 2011 to 2027.4 millions 2036. Working age 15 to 59 62.5% 2011, peak at 65% 2036. Determinants, high fertility, youthful population, improved mortality, rising elderly population. Migration, young males dominate urban migration. Sex structure, sex ratio 1020 females per 1000 males and FHS 5 2021. Sex ratio at birth 929 girls per 1000 boys. Under enumeration of women in censuses. Population policy and demographic dividend. National Population Policy 2000 achieved TFR of 2.1 achieved in 2021. Population stabilization by 2045. Universal education, reduce IMR MMR, promote small family homes. Criticism, narrow focus on contraceptions, 13% unmet family planning need. Demographic dividend, working as 15.64 60% 2024, peak share 64.8% 2030. Median age 28.2 years. Benefits: economic growth, saving, tax revenue, competitiveness. Challenges: skill gap only 4.7% workforce skilled. Unemployment 50%, youth unemployable. Gender inequality 24% female workforce participation. Health 35.5% children stunted. Uneven demographic transition north versus south. Forward looking policies: invest in education, health skill, enhance urban infrastructure, female participation, federal governance for north south disparities. Aging and migrants trends: elderly 60 plus 103 millions 2011 to 347 millions 2050, 20.8% of population. Challenges: limited pensions, healthcare access for migrant elderly, social isolation due to family separations. Solutions: promote healthy aging, WHO decades 2021 to 2030, regulate old age homes, support in situ aging. Population education concept: educate on population issue for rational behavior. Thrust: sustainable development, family planning, adolescent health, gender equality, HIV/AIDS awareness. Need: stabilize 1.44 billion population 2024, addresses youth birth, gender bias, sustainability. Updated social issues 2024 to 2025. E-Shram 28 crore registered workers, ONORC 80 crore PDS beneficiaries, TFR 2.0 and FHS 5.5 below replacement level. Unemployment 50%, youth unemployable, gender 24% female workforce participation. Health 35.5%, children standard 7.7% severely wasted. Key UPSC point: prelims focus on numbers, migrant population, TFR, dependency ratio, sex ratio. Schemes like E-Shram, ONORC, and policy names like National Migrant Labour Policy and PP 2000. For mains, analyze impacts, policy gaps, and solution linked to demographic dividend, aging and population education for comprehensive answers. Use updated data for current relevance. This is the end of lecture. If you want PDF of this video, you can join our Telegram channel. Link is given in description of this channel. Thanks for watching. Jai Hind.